Question number 8, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by all his recent statements on health services?
The Honourable Tony Ryall.
Yes, including the statement that the government is investing the highest percentage of GDP in health ever. At the same time, health boards are increasing their frontline services.
Honourable Ruth Dyson.
When he said on Sunday 20th of June of this year that National would not be closing the wage gap with Australia for doctors as a means of stopping our doctors leaving our shores in droves, had he forgotten that closing the wage gap with Australia was exactly what he promised to do in his press statement of 30th of September 2008?
The Honourable Tony Ryall.
Mr Speaker, of course, the government is not going to be able to close the wage gap with Australia overnight. But this government is taking a lot of steps that will do that, and part of that is our substantial program of tax cuts announced last month that for an average hospital doctor on $165,000 a year, they'll be better off by $7,000 before GST.
Supplementary.
Honourable Ruth Dyson.
When he promised that frontline health services would be increased under National, was he excluding the elective surgery and support services that are not happening this week at Wellington Hospital, which is closed down to save money?
The Honourable Tony Ryall.
Well, Mr Speaker, as the member would know, it's up to the Capital Coast DHB how they manage their staff leave. But what I can tell you is that elective surgery is being performed at Wellington Hospital today, as it was yesterday. All acute surgery is operating as per usual. Capital Coast delivered 6,600 elective operations last year, more than ever before.
Very good.
And I can also tell the member that the emergency department is seeing about the same number of people they saw last week. We have inherited from Labor a deficit of $60 million at Capital Coast DHB, and we are slowly trying to manage that legacy of failure from the party opposite.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, what other comments has the Health Minister made about health services that he stands by?
The Honourable Tony Ryall.
Mr Speaker, I stand by our comment that we are not prepared to be a government that over 9 years doubled the amount of money in the health service and provided fewer elective surgeries for the people of New Zealand on a population basis. Under this party in government, 13,000 extra people have got elective surgery last year, more hip replacements, more cataracts fixed, and more people who no longer have back pain.
The Honourable Ruth Dyson.
When he was described as having a counter-offer for every home support cut that was described to him, cuts also described as cruel and unfair and frightening, was he saying that the thousands of New Zealanders who have had their home support cut in the last 12 months were ripping off the system? If not, why did he use 2 examples of fraud to justify those cuts?
Honourable Tony Ryall.
Well, it's quite unfortunate, Mr Speaker, that member opposite continues to try and ignore the facts that have been made available to her. As she knows, particularly in Wellington, about 650 people have come off home support, 650 have come on home support in the last 9 months, 82 have had their home support increased. What we know is that every year around about 15,000 people come on, 15,000 people go off, and this government is putting more money into important frontline services, including home support.
Question number 9, Nikki Wagner.
Thank you, Mr.